Well, hello, I'm Elaine Wirrell, and I am a pediatric epileptologist from Mayo Clinic, working very hard with the SCN8A Alliance on this project. So the modified Delphi process is a process that we use for consensus building if there is not high quality evidence in the literature. And so it can be very helpful for conditions like SCN8A, which are quite rare. So I'll just walk you through the process. So we started with our core panel of 13 clinicians and 6 families, and we divided that core panel into 3 groups, each tasked with reviewing the literature and coming up with specific potential questions for the first survey. And the 3 groups were on diagnosis and phenotype, treatments, and prognosis and clinical features. And they were asked to answer those questions, and if they disagreed with any of the statements that we had made, to provide feedback on that. The leadership team then reviewed each questionnaire and identified where we had consensus and also areas where we did not have consensus, and then reviewed those comments from the panelists to see if we could reword those questions to potentially gain consensus. And so that process was repeated twice more for a total of 3 rounds. Following that, the leadership team then prepared a draft manuscript and sent that back to our review panelists for further input, modified that as needed, and that was our final consensus report. And for our reviewers, for the clinicians, we asked them how many years they had been involved in either treating or studying SCN8A, and you can see for the vast majority that was more than 6 years. We also asked how many patients had they treated with SCN8A, and again, you can see for the majority that's more than 4 patients. For the caregivers, they were asked to indicate the age of their loved one with SCN8A, and they were also asked to indicate, besides their loved one, how many other cases of SCN8A were they familiar with. And you can see that the caregivers were familiar with certainly more than 6 other cases in the vast majority. So understanding consensus level based on the level of agreement that we obtain. So strong consensus were if more than 80% of panelists strongly or fully agreed with the statement. Moderate consensus was if 80% or more fully or partially agreed and less than 10% disagreed. And modest consensus was if 67% or more fully or partially agreed and less than 10% disagreed. And so we reported the level of consensus for each statement in the manuscript. And in this summary today, we're going to report consensuses of modest or greater. For each question, it was possible that our panelists maybe didn't have an opinion, and so they were asked to comment, no comment, or don't know responses, and we excluded those from analysis. However, we did want to ensure that we had an adequate number of people who responded appropriately to each question. And so if we had a total responder rate of less than 50%, we did not consider that consensus. It's important to understand the limitations of the modified Delphi process. So this is an excellent process to try and build consensus where there's limited evidence in the literature, but it is not equivalent to medical advice. So certainly I think it's appropriate to share the reports from this consensus with your loved one's medical providers. And hopefully this will help us work together to try and gain a higher level of expertise and potentially even consideration of randomized clinical trials, randomized placebo-controlled trials to look at therapies that can better treat SCN8A.